In today's news, Phuket wants to be the first province to declare COVID endemic. Meanwhile, an MP in Parliament discusses the inconvenient truth of a high-profile human trafficking case, and the Thai government wants to hire celebrities to tell Thais to have more babies. More on these stories in today's program. You're watching Thailand News Today, but of course you know that already, bringing you the top headlines in Thailand and beyond. My name is Jet Gunther, and in our first story, Phuket officials want to declare COVID endemic, even as the infection rate is rising on the southern island. According to a report, Deputy Governor Pichet Panapong says achieving endemic status would allow officials to focus on economic recovery. Local officials would also like to get rid of the daily reporting of new infections, instead only reporting on COVID cases involving moderate to severe illnesses. He said, quote, Phuket would be delighted to be the first province for the declaration. I hope this will alleviate concerns about the virus and shift focus to economic restoration instead. According to Thailand's National Communicable Disease Committee, a province can declare COVID endemic if 1. The infection rate does not surpass 10,000 new cases a day. That's check. The fatality rate does not surpass 0.1%. And over 80% of high-risk people have had at least 2 vaccine doses. Pichet is also calling for the self-isolation period for infected patients to be shortened from 10 days to 5. During the first 5 days, he says patients should be able to self-isolate at home, at a hospital, or in a hospital. After that, they should be allowed to return to normal life while observing strict disease prevention measures for another 5 days. The deputy governor says this would address the problem of work absenteeism due to the virus. Phuket officials insist the island is safe and can care for both locals and tourists alike. It has rolled out vaccines to young children. The wearing of face masks is still mandatory, and patients with mild symptoms can be provided with basic treatments and favipiravir pills while self-isolating. The deputy governor added that up to 3% of tourists are testing positive, with 4% of them found to be infected in day 5 tests. Phuket reported 549 new infections on Saturday. Of those, 67 were in sandbox tourists and 49 were in test-and-go arrivals. The story of a major human trafficking case involving Rohingya people being trafficked through Thailand and to the Malaysian border was brought back to light after an MP told another side of the story. During a general debate in Parliament, he discussed how a former police officer who was charged to lead the investigation had to flee to Australia for his own safety because the case implicated too many influential figures. The investigation started in 2015 when security forces found a camp in Songkhla province which housed Rohingya migrants who are said to be victims of a human trafficking gang. Mass graves with bodies of refugees were later found at camps in the southern border region, many said to have died from starvation. Some were tortured. Move Forward MP Rangsiman Rome claimed that former police Major General Pawin Phongsirin had fled Thailand after working on the case because many influential people and senior officials were involved. Rangsiman brought up the report from the case which said some migrants had paid 10,000 to even 70,000 baht to be transported from Myanmar to Malaysia, but they ended up at the camp where they were abused. Some say they were tortured, some women were raped, some were sold into slavery, and many were left to die at the camp. According to the report, this has been going on for 10 years. The MP told the story of how Pawin led an investigation, discovering that many residents, local politicians, police officers, soldiers, and other influential persons were behind the camp and trafficking operations. One of the most high-profile suspects was former Lieutenant General Manat Kongpan. Pawin was ordered to transfer to the, quote, Deep South provinces to investigate further, but he asked the national police chief to reconsider his transfer as he feared that his life would be in danger if he were in the South. The plea was rejected. With so many powerful and influential people involved in the trafficking operation, the MP says Bowen decided to resign from his position and later moved to Australia for his own safety. According to Thai PBS World, Bowen spoke to a member of the progressive movement, saying he was happy his story was told. He said, quote, "Today is one of my happiest days. It is a story of my hardship, which has brought me nothing but stress since I escaped from Thailand 6 years ago." Now, many Thais have been discussing the case since the MP's statement, sharing the hashtag on social media, hashtag Khamanut, which translates to human trafficking.
Hi, Tim here from the Thaiger with Sean from 5-Star Marine, and a lot of people want to know about Maya Bay. It's a really popular place to come. Firstly, how long does it take to get to Maya Bay from here?
About 55 minutes by speedboat out there, and obviously reopened January 1st, and that reopening week was really busy. But what's happened now with Test and Go closing, a lot less people are coming to the island, and Maya Bay actually just in the last few days, only just a few boats going there. So it's the perfect time. If you want to go and walk on Maya Bay, now's the time to do it.
So the famed beach, you could have pretty much all to yourself. As you can see, perfect weather. There's barely a cloud in the sky. We're lucky to be here. You can come here if you want to. The sandbox is still open. And 5-Star Marine are the people to contact if you want to head out to the islands. Thanks, Sean.
Thanks, Tim.
One of Thailand's most respected experts in virology says daily new infections in the country could reach 100,000. Dr. Yong Puwarawan from the Center of Excellence in Clinical Virology at Chulalongkorn University says the rapid spread of the Omicron subvariant BA.2 has taken daily infections to 15,000 in Singapore, where the population is a tenth that of Thailand. If the spread follows a similar trajectory here, Thailand could soon see 100,000 cases a day. Yong says infections in Thailand will have to reach their peak before they begin to level off and drop, as has been seen in several European countries and the US. Given that daily new cases will continue to rise for now, the virologist says everyone must do their utmost to reduce their risk of contracting the virus. People who do test positive should have this confirmed by PCR tests and then self-isolate at home or in community isolation facilities. He goes on to say that if 100,000 people a day were to take a PCR test, with each test costing an average of 1,000 baht, the total cost of just one day would be around 100 million baht. In that situation, it would be impossible for everyone who tests positive to be admitted to the hospital. Yong says Thailand's current rate of infection is 10 times that of what was seen in the first 4 waves of the virus, making it possible for the first time to reach a 6-digit daily infection number. Thailand wants women to have more babies, and authorities plan to hire influencer mothers and celebrity parents to help inspire young couples to have children. The Public Health Ministry is leading the effort following reports that the birth rate in Thailand dropped to its lowest rate in the past 50 years. That's what happens when you lock down the entire country. In the past, the average Thai woman would have 5 children. With concerns of overpopulation, the government launched a campaign in 1972 which translated to more babies, more poverty. But now, the falling birth rate is posing a threat to Thailand's economy. Who'd have thought centralized planning would have knock-on effects? The Office of the National Economic and Social Development Council now says that the low birth rate could lead to problems in the future, such as labor shortages and less tax revenue. The idea was met with a backlash, as people are saying that the government should instead focus on fixing the economic crisis because that was the reason why people avoid having children. The Deputy Minister of Public Health, Sathit Pitutecha, shared that the low birth rate is a national topic. He said that it is good that the public is sharing their opinions on the campaign, adding that the idea to hire influencers is just one of the plans, and there are more steps the government plans to take to fix the problem. The minister also discussed the cost of living and how the government plans to make it more affordable for families to raise children. Well, I hope you enjoyed all the news that I have for you. That was very drying to my throat. So I'm going to take a sip from the Thaiger mug number 1 and Thaiger mug number 2. You can find these also on the Thaiger shop at very reasonable prices. And that's all for our report. Thailand News Today will be back tomorrow. Meanwhile, you're not up to date on the Thaiger.